Are you curious about unexpected mid-cycle spotting? Don't fret, you're not alone. This week on Siobhan Talks Periods, I'm diving deep into the world of mid-cycle spotting to answer that burning question that a lot of women have: should I be worried? So, spotting or mid cycle bleeding is actually quite common. There's often no need for concern. 10 to 30% of women experience spotting at ovulation for 1 to 3 days. And there are other causes for this spotting, which is also called intermenstrual bleeding. And some of those reasons are hormonal imbalances, perimenopause, polyps or fibroids, some medications, hormonal birth control, some infections, including STIs, and a condition known as cervical ectropion. In this video and in my written blog, which is linked in the description on YouTube and the bio on Instagram, I'll discuss 3 reasons for mid-cycle spotting that doesn't require medical treatment and 4 reasons that you might want to go see your doctor. First, here are 3 reasons for mid-cycle spotting that you don't need to see your doctor about necessarily. So, the most common reason for spotting during the middle of your menstrual cycle is ovulation itself. In women who aren't taking oral contraceptives, that is, mid-cycle bleeding is most likely ovulation bleeding. It typically occurs 7 to 20 days after your last period. It's light, often lasts somewhere between 12 to 74 hours. It is considered normal and it generally isn't something to worry about. What's happening is that at ovulation we have this sudden surge in estrogen which subsequently drops, causing a destabilization of the lining of the womb, which causes that short bleed. The second most common reason for mid-cycle spotting is hormonal imbalances, and it can occur at any time between periods, not necessarily just at ovulation. And it can be attributed to fluctuations in hormone levels. It can also be associated with anovulation, which is a failure to release an egg, or with polycystic ovary syndrome, PCOS, or simply irregular hormone production. Often a naturopath or a herbalist can be a really great person to see to help to rebalance hormones in these cases. Ovulation bleeding, which I mentioned above, can also be more likely to occur due to hormonal imbalance. So, for example, if estrogen levels are higher, then they can drop more steeply post ovulation. So, there's a larger surge and drop, and that can further destabilize the uterine lining. Thirdly, mid-cycle spotting is also more common in perimenopause when estrogen and progesterone levels can fluctuate a lot and also cause anovulation too. And these fluctuations then can lead to the uterine lining not developing as consistently or as predictably as it once did, causing that mid-cycle spotting. Next, here are 4 reasons that I would recommend seeing a doctor for mid-cycle spotting. 1, if you don't regularly have mid-cycle spotting, but it starts all of a sudden, along with some other symptoms, maybe like pain or fever, you may have an infection like cervicitis or pelvic inflammatory disease, or some STIs can cause spotting too. It would be important to get this ruled out with a doctor and treated immediately if there is an infection present. Second is uterine polyps or fibroids. They're non-cancerous growths in the uterus that can sometimes cause irregular bleeding, including mid-cycle spotting. The growths can irritate the uterine lining, which leads to the spotting and sometimes heavier bleeding. So if you have heavy bleeding as well as mid-cycle spotting, it might be worth seeing your doctor. They can often refer you for a scan or other tests to diagnose the polyps or the fibroids. And if you're looking for natural support for that as well, a lot of naturopaths and herbalists can work alongside your doctor to support you in this. Thirdly, we have certain medications like blood thinners, also hormonal birth control methods like birth control pills, patches, implants, injections, IUDs, intrauterine devices. They can all sometimes cause mid-cycle spotting, especially when they're first being used or if there's a change in your prescription. And always, if you think there's anything to do with a prescription that's causing any side effect, it's really important to talk to your doctor. The fourth thing is something called cervical ectropion or cervical erosion, and it's a condition called that where the cells of the cervical canal are present on the outer surface of the cervix. Bit of a tongue twister. This can make the cervix more prone to bleeding, more sensitive, especially during intercourse or when it's being touched. It's usually benign. It usually doesn't require treatment, but it is worth getting it diagnosed anyway, especially if your spotting happens after sexual intercourse or after, say, like a cervical smear test, also known as like a pap smear, so that could be something to look into. If you have ongoing mid-cycle spotting and it is worrying you, it can be helpful to see a doctor anyway to rule out any more severe underlying causes, like maybe endometriosis as well, or fibroids or polyps or STIs, and just to give yourself that kind of peace of mind. Although relatively rare, uterine cancer and cervical cancer can also sometimes cause mid-cycle spotting. So it can be helpful to rule these things out with your doctor especially if you're feeling worried about it. It's so good to listen to our instincts. Our periods offer such amazing insights into our health. It's really important not to dismiss our womb wisdom. So, if you feel like you need some medical tests to rule some things out, then book an appointment with your doctor. However, it is worth stating that once these things are ruled out, and if a simple hormone imbalance is suspected, many doctors do prescribe hormonal birth control, which only masks the symptoms and doesn't actually fix the hormonal imbalance. In which case, I would recommend seeing a herbalist or a naturopath or a natural practitioner who can help you address the root cause of the hormonal imbalance. Regular gynecological checkups are, of course, really important for maintaining your reproductive health and addressing issues early on, but many natural practitioners can help address these issues as part of a complementary treatment as needed.